If you've been having some joint pain and got a diagnosis of arthritis, I get this question all the time, and it probably has crossed your mind. Who do I go to? Do I need to see a special doctor? Can I just go to my family doctor? Who do I need to see to best manage this? And I'm going to address that today. If you like this video, go ahead and hit that like button as we're going through, and then also hit that red subscribe button below so you can get updates when I release new videos. So when you start to have some joint pain, and especially as we get older, we think, oh, this isn't right, this is not normal, I need to go get this checked out to make sure it's not going to get worse, etc. So many times the family doctor is our first person that we go see. They're who we typically see for everything, so they have some rapport with you and they know kind of what you've been going through so far. Now, when you go to the family doctor, they may mention arthritis. Arthritis, osteoarthritis in this case, is typically characterized by joint pain, joint stiffness, and it's popular in the knee, hip, and low back. You can also get it in your hands and other joints as well, but those are the common joints that you typically see it in. When you have pain in the morning, stiffness in the morning, and then it gets better as you get moving, but then maybe it comes back in the evening, or you just notice it throughout the day. These are all common symptoms of arthritis, and so they may even give you a diagnosis without doing an x-ray. It kind of depends on the doctor and how they typically practice. Now, the problem with some family doctors is they're known as generalists. So they have a wide range of things that they need to know something about. And osteoarthritis might be a very small sliver of that pie that they have to uphold. If this diagnosis of arthritis comes up, and if you notice that they just give you a couple of handouts, you're only with them for 5 to 10 minutes, they don't necessarily answer your questions, they just don't necessarily have the time to explain what's going on because they have lots of other patients to see, this may be a sign that maybe we need another person on our team. I always say arthritis is a team effort, so maybe we need someone that's on our team that can answer some of those questions. Now, the good thing about family doctors is they can refer to physical therapists. Now, physical therapists are going to be your movement experts. And one of the biggest impairments with osteoarthritis is it impacts your movement. Both pain and stiffness limit your movement. They also, when you have pain when you move, it really creates this fear within us that we don't know what's going on. We don't want to make things worse, so I'm just going to stop moving altogether. But movement is one of the best things for osteoarthritis. And it was actually shown that if you don't load your cartilage, meaning you don't move or participate in physical activity, it can actually increase the progression of the arthritis. Whereas movement and appropriately dosed physical activity can really help decrease your chances of the progression of arthritis. So this family doctor, they may not necessarily automatically mention it, or they may not automatically refer you. But if you bring it up in conversation, oh, I've heard physical therapy can be great for this, then they usually are very welcoming and can write you a script for it. Then with the physical therapist, again, I would do a little bit of research. Make sure that it's someone that you know, or someone that a family friend has gone to, or you've looked through their reviews and everything. We want to make sure that it fits your needs. Everyone is different and everyone has different needs. Everyone can click with different people and may not click with others. So you want to make sure that you have the right fit, because arthritis is a long-term thing. Now, it doesn't necessarily mean you're going to need physical therapy for the next 10 years, but you want to make sure that you have someone that can initially help you and can initially treat you, get you out of pain. Then if you 6 months later start to have more pain, hopefully you can go back to the same person where they already kind of know what you've been through already, and it just makes things a whole lot easier. But a physical therapist can be that movement specialist to help you really start to get into an exercise routine, really start to understand what arthritis is. Because many times if you don't have someone to answer those questions that you have, What can I do? What shouldn't I do? What type of pain is okay? What type of pain should I avoid? All of these things kind of rush into your head when you hear that you have arthritis. But if the primary doctor can't answer those questions, if the physical therapist is too busy and can't answer those questions, then we have to bring someone else in. Now, between the family doctor and the physical therapist, typically they make a pretty good team in handling osteoarthritis. But if you start to notice some complications, or you start to notice that your pain just won't go away, no matter what you're doing, no matter what you try, it's just not going away. Maybe you have some other symptoms starting. Maybe you have some overall fatigue. Maybe you have some pain spreading down into your feet or your hands. You notice your hands are getting swollen, they're red. Maybe you start to feel like nauseous. Any of these other symptoms that are out of the blue can be a sign of what's called rheumatoid arthritis. And sometimes osteoarthritis and rheumatoid arthritis can have a middle ground. So rheumatoid arthritis affects a lot more joints than osteoarthritis typically does, and you have some other symptoms because it is an autoimmune disorder. So that's when you have some of that fatigue, some more of those flare-ups. There's lots of other things that go into it. But if you do start to notice some of those symptoms that just don't seem to be just kind of joint pain, joint stiffness, maybe some fatigue from not sleeping well, then we can bring in what's called a rheumatologist. Now, a rheumatologist specializes in rheumatic disease, which is disease of bones, connective tissue, inflammatory conditions. Now, rheumatoid arthritis tends to be the more popular inflammatory arthritis that they typically handle, but I've found that a lot of clients kind of have some overlap. Maybe they generally have osteoarthritis, but maybe have some of these other symptoms. Pain medications or conservative treatment like physical therapy and exercise just really aren't cutting it. It's always good to speak to a rheumatologist because what they do is they specialize. So it's not like the family doctor who has just this whole gamut of things. A rheumatologist actually specializes in these inflammatory conditions. And so they might be a little bit more up to date on some of the more recent medications that have been successful, maybe some of the more recent treatments that have been available. So they may be more up to date on some of this information. But if you just have typical arthritis where you just have some of that joint stiffness, joint pain, you may not necessarily need to consult a rheumatologist. But it's always a good person and a good option to have if you do start to notice some of those other things or just seem that nothing is helping. Then this might be a good person to seek out. Now, the last one is sometimes when we go see a family doctor, or maybe we even see a physical therapist, and you think the pain is just so severe, it's really impacting your quality of life. Nothing seems to be working. You've given a good effort to conservative management, movement, exercise, really gave it a good effort. And you've given a good effort to lifestyle changes. An orthopedic surgeon could be someone that you should see. But the caveat being, we want to make sure that our pain is so severe and that it is truly impacting our quality of life that we just really can't enjoy our life because of this pain. It's just really holding us back. Because most of the time, again, depending on who you see and what they specialize in, most of the time, your orthopedic surgeon is going to do a surgery consult. And they're going to talk to you about surgery as one of the primary options. A lot of times, even patients think that with arthritis, you have to get surgery. And that's not the case. But it is the case in some if the pain is so severe. And you do have to think about it personally as well. Because like I said, if you can't enjoy your life because of it, if it's just really holding you back, then surgery is an option. It's not necessarily an easy option, because of the long recovery, the time that it takes, and the expense of it. But the orthopedic surgeon is going to take some x-rays, likely, They may mention terms like bone-on-bone degeneration, and I'm really trying to push people to actually understand what bone-on-bone and degeneration is, because a lot of times if you are bone-on-bone, it doesn't necessarily correlate with pain. There are many other things that go into it, but this could sometimes lead to premature surgeries. And if we go into premature surgeries, they may not correct the full issue. That's why it's good to also have some opinions from a physical therapist, a primary care doctor, and really try to give it a good conservative effort. Because like I said, most of the time osteoarthritis can be managed conservatively. Now, one I didn't mention that pairs well with a physical therapist is a nutritionist. Osteoarthritis is very much driven by inflammation. Inflammation can be triggered by our food choices, and lifestyle changes can make a huge impact on that. So if you're having trouble deciding what type of foods you should be eating, what type of foods maybe you should be decreasing your consumption of, then it's definitely a good idea to even just get a consult with a nutritionist or a dietitian and see if it can truly make a difference. I know a lot of people that have just changed their eating habits and have seen pain decrease significantly, especially those that are motivated to avoid the surgery route. So the tree kind of follows the family doctor, the physical therapist, potentially a nutritionist, and then going to the rheumatologist, and then the orthopedic surgeon. And I always recommend people to kind of follow this trajectory. Now for me, I am a private physical therapist, and so people can come see me without a doctor referral. So if you're just having knee pain, knee stiffness, maybe it goes into your low back sometimes, but those are really the only symptoms that you're noticing, seeking out a physical therapist can save you a trip to the doctor, save you that money there, and then we can just work on it. I'm also skilled to say, if you are having some of these other symptoms, maybe we do need to go to your family physician, or maybe we do need to go to a rheumatologist, but we can kind of rule some of those things out. And so those physical therapists exist as well. And those are great for osteoarthritis because, like I said, the disease is usually pretty simple for the most part. Now, there's a lot of different variables and things that go into it. So you have to be skilled in knowing those, especially the up-to-date information. But for the most part, it can be managed conservatively with diet and exercise. But the problem is, if we just say and just hear maybe from a family doctor, an orthopedic surgeon, you just need to lose weight, you just need to exercise, well, that doesn't really give us any guidance or any direction. So that's why I always recommend that people at least seek out a physical therapist or a nutritionist, because once diet and exercise are really honed in, they can make a huge impact on your pain. Now, it doesn't work for everyone, and surgery can be an appropriate route, and that's totally fine. But I always kind of recommend going through this chain of people, because that way you kind of ensure that you don't rush into a premature surgery, make sure you don't miss out on anything, and that way you really have a well-educated decision, because surgery is a big decision. And like I said, it's not always inevitable, though people think it is. And so you don't necessarily have to rush out to a rheumatologist either. But one of the scenarios where a rheumatologist may help is if maybe you're not getting the answers that you're looking for from your family doctor or from your physical therapist, and you just want a little bit more guidance, then a rheumatologist might be the way to go. Again, do your research, ask around, ask your friends, and see who they have used that maybe you can use as a referral, or you can look online and look at the reviews and things. Again, you want to make sure that this person is going to be the best fit for you. Any person that you see, family doctor, physical therapist, dietitian, rheumatologist, or orthopedic surgeon, you want to make sure that they're answering your questions. You want to make sure that they are able to listen. You want to make sure that you feel educated enough in your information about arthritis and that you actually understand, instead of having to go to Google and things, because there's lots of misinformation out there. And so we just want to make sure that they're listening and that they are actually taking into consideration your life, your lifestyle choices. All of those things really combine into one. So again, there are lots of different options for professionals to see for arthritis. And you have to choose who is going to be the best for you and who's going to give you the most information that you need. Because there's been tons of studies that people just aren't getting the information they need about their arthritis and aren't able to make these educated decisions. And so they go to an orthopedic surgeon right away, or they don't even try physical therapy because they were never told about it. And then that leads to premature surgeries, potentially another surgery for a revision, and lots of other pain pills, all of those things. And then we don't even know that physical therapy exists, or we don't even know we should seek out maybe a dietitian is our issue. So it definitely is a team approach, but you have to find the right team for you. So there, like I said, lots of options: family doctor, physical therapist, nutritionist, rheumatologist, and then orthopedic surgeon, or just a sports medicine type doctor. So I hope this was helpful. Go ahead and hit that red subscribe button below to get updates on all of my new videos. And I also want you to comment below about your experience. Who is the doctor that does the best for you? Maybe it's a family physician, maybe it's a physical therapist, maybe it's a orthopedic surgeon that maybe talked you out of surgery and went a different route. There's lots of different scenarios, different situations. And so this is, again, just a general overview. And it all depends on the professionals you're seeing and who you connect with and who satisfies your needs the most. So thank you so much for watching. My name's Alyssa with Keep the Adventure Alive, Physical Therapy and Performance. I'm an arthritis specialist and a doctor of physical therapy based in Utah. Thanks for